and welcome to Dr. A for Animals, the podcast that gives you reliable answers to your questions about animal health and wellness and useful tools to help you help animals, whether in your own home or out in the wild. Together with expert guests, I'll give you information that is based on scientific research and clinical experience. I'm Dr. Charla Ansorge, a small animal and exotics veterinarian, and I'm so happy to share my love of animals with you. Let's get started. Welcome to episode 5 of Dr. A for Animals. Today we're going to be talking about oral health and dentistry in dogs and cats primarily, although we will talk a little bit about some other species of interest towards the end of the show if you're interested in that. Mostly we're going to focus on our canine and feline friends. I'm very excited to welcome to the show Dr. Lindsey Schneider, who received her doctorate in veterinary medicine at Cornell University, completed a rotating internship at the Veterinary Specialty Center of Tucson, and then worked for about 3 years in small animal general practice before she went back to Cornell University to complete a 3-year residency in dentistry and oral surgery. She now practices entirely in dentistry and oral surgery. I hope you enjoy the show today and learn a lot. Dr. Schneider has so much really excellent, helpful information to share with us today. All right, welcome to episode 5 of Dr. A for Animals. We're talking about oral health in dogs and cats today, and I'm so happy to have you on the show, Dr. Lindsey Schneider. Welcome to the show.
Thanks for having me.
All right, well, let's go ahead and just jump into our discussion. So I find a lot of clients, when I'm talking about dental health with their dogs and cats, are a little surprised. Some clients have been through this before and they know what we're talking about, and others are like, why do I care if my dog's teeth are white? So let's talk a little bit about why dental health matters in our dog and cat friends.
Yeah, so the mouth is a really important and special place in the body. My mentor once explained it to me as it's really the only place where kind of the outermost layer of the body, the skin and the mucosa, is punctured by like stuff coming out from the inside. So you have these teeth that are weird little bony-like structures penetrating through the skin of the body. And so that creates this really unique environment where there's a whole ecosystem going on. You have bacteria living in there. You have all sorts of microorganisms and the body's own immune system and everything. So a lot of special stuff happens in the mouth, and it's kind of one of the first places where disease can start, and it can spread elsewhere in the body. So it's really important for us to take care of it.
Yeah, that's a really, really cool way to think about it. I mean, I've never really thought about it in those terms. So dental health can affect other systems in the body. Is that so?
Yeah, so a lot of what we know about animal oral health actually comes from human oral health and dentistry. There's a lot more research that's been done sometimes on animals, but for kind of a human purpose. But we have, in the past probably 30 or 40 years, the veterinary community has become more and more aware of the importance of oral health, and so we're starting to extrapolate from human studies and vice versa, using animal studies to also model human disease. And what we're finding is that oral health can affect everything from endocrine diseases. So, for example, diabetes in both humans and pets can be very closely tied to periodontal or gum disease. Things like heart disease or endocarditis, so an infection on a heart valve, that can often stem from underlying oral infection or periodontal disease. So there are a lot more potentially life-threatening conditions that can arise if you're not taking care of your oral health.
Mm-hmm. So some pretty major consequences to not dealing with oral health. And then there's also, of course, the consequences to the mouth itself if we're not addressing oral pain and what other kinds of conditions are potentially happening in the mouth if we're not daily brushing teeth and then maybe once a year having a dental cleaning.
Right. It's a lot like we kind of can think of how we take care of our own oral health and how important that is to us. And just granted, it's not a one-to-one comparison between people and animals, but a lot of times chronic dental disease can just cause low levels of discomfort, pain, and really affect everyday quality of life. If you think of people that have a dental infection, they often report just kind of intermittent episodes of headaches and appetants, all sorts of issues. And so we have to assume our pets are experiencing similar problems.
And they won't tell us about it.
Exactly. We have to kind of rely on either preventative care and diagnostics or kind of very closely monitoring for signs of discomfort, pain, and disease. Mm-hmm.
And can we talk about some differences between dogs and cats' dental anatomy, the types of dental disease they get, and that sort of thing?
Yeah, this is something that is really interesting to me because, as I mentioned, we can extrapolate a lot from people, but some of the diseases that people get and that animals get are a bit different because of their differences in anatomy. So in people, we have very tight interdental spaces. So you can think of our teeth are really close together. And so for us, we're always talking about flossing our teeth. And so that's not as much of an issue in dogs and cats, although I will talk a little bit later about different strategies. We'll come back to that. But so they don't have as much issues with cavities forming in between little nooks and crannies. So in humans, cavities are probably the most common dental disease that we see. And we know that they are caused by bacteria that kind of flourish in an anesthetic environment. And so in dog and cat mouths, they have a much higher pH in their mouth. So their mouth is less basic or is more basic, less acidic. And so those bacteria that cause cavities actually can't survive in that oral environment in dog and cat mouths as well. And so what studies have shown is that about 5 to 7% of dogs will develop cavities. In my experience, it's actually even probably less than that. I would say maybe somewhere more in the range of 2 to 5% of my patients. And then in cats, we actually don't think that they get true cavities. It hasn't been well documented. Instead, there's another condition they get, tooth resorption, that can sometimes mimic cavities.
Mm-hmm. Interesting. So let's talk about then the kinds of dental disease, if that's an appropriate phrase even to use, that dogs and cats do get.
Yeah. So there are certainly conditions that can develop in the mouth that are not related to the teeth, but dental disease is by far the most common condition that we see in cat and dog mouths, and actually in their overall health, periodontal or gum disease is the number one diagnosed problem in our cat and dog patients. So periodontal disease is a disease of the gums and the tissues that attach the tooth to the jawbone, whereas endodontic disease is disease of the inside of the tooth. And that's another condition that we can see, kind of another type of dental disease, very common in cats and dogs, but generally endodontic disease is caused by tooth fractures or the tooth breaking and the pulp becoming exposed or some other type of trauma. Occasionally it can be caused by the tooth dying due to another disruption in the blood supply to the tooth or some type of anatomical abnormality. But for the most part, we're seeing periodontal or gum disease as kind of the number one thing in both cats and dogs, and then endodontic disease or broken teeth as kind of the number two oral condition.
So tell us a little bit more about tooth fractures, because we see those pretty commonly in both dogs and cats. So one would expect that to be painful. But then from what we know from people, it perhaps doesn't stay painful, but it's still a risk factor for oral health. So talk to us a little more about that.
Yeah, so when we identify a broken tooth, kind of the first question we have to ask is whether or not the pulp has been exposed. So if we go back to kind of thinking about the anatomy of the tooth, there's kind of three layers. The outermost layer of enamel is the hardest substance in the body, and that's very thin. And then underneath the enamel is dentin, which is a hard tissue that's similar to the enamel, just a little bit more porous. And then inside of the dentin is actually the structure, the pulp, which contains nerves and blood vessels. So this is soft tissue kind of encased in a hard shell. And when the pulp gets exposed to the oral environment, that's when we know that we have pain, because that nerve ending can be very sensitive. And that's also when we know that bacteria are going to get inside the tooth and cause that tooth to die if we don't treat it. And so that's kind of where the implication for treatment comes in, is whether or not the pulp of the tooth has been exposed. As for pain, as I mentioned, when the pulp is exposed, it is acutely painful. People that have broken a tooth have experienced that. Sometimes, though, in our dog and cat patients, we don't see those outward signs of pain because they're stoic and they are kind of designed to hide some of their signs of pain. But they can go through that acute period, and gradually the pain might subside as the nerve dies off, and there's no longer, when the tooth is dead, there's no longer a living nerve inside. And so there can be a period, sometimes days, weeks, months, years, where nothing is happening and the animal isn't feeling anything associated with that tooth. But at any point, it could become infected and develop inflammation around the root, and then that can be very painful as well. And that can then cause other issues like facial swelling and a fever, or getting systemically ill, feeling not well, not wanting to eat, things like that.
Okay, so those fractured teeth are a problem.
Yes.
So let's talk also about some of those interesting lesions in cats. You mentioned resorptive lesions, and that's kind of a cat thing, although we see it a little bit in dogs.
Yeah, so tooth resorption is unfortunately very common in cats. About 50% of cats will develop tooth resorption at some point in their lives. And it is an idiopathic disease process, meaning we don't know what causes it most of the time. In certain specific cases, we know that the resorption can be secondary to inflammation. Or there are cases when tooth resorption can be normal. For example, when you have a baby tooth that's getting ready to fall out, the root undergoes resorption. And that is part of the normal physiology of the body. But in cases of kind of this pathologic or problematic tooth resorption that we see in cats, for some reason that we don't understand, cells become activated that start reabsorbing the hard tissue of the tooth. And so often it starts below the gum line on the root surface. And at that point, we might not have any outward signs other than taking an x-ray and seeing changes in the root structure. But then as it progresses above the gum line and we have inflammation developing and little nerve endings getting exposed, then it becomes acutely painful and then chronically painful. And over time, it can even lead to the crown of the tooth kind of breaking off. So tooth resorption often will cause more outward signs of oral pain, things like chattering or kind of acting like something's bothering them when they're chewing.
And often there are either no signs or the signs are so subtle and unrelated. One of my kitties had a resorptive lesion in one of his teeth, and I didn't know. He was eating completely normally, but I had noticed that his coat was a little bit more coarse than usual. For a couple of months, I was noticing this, and then I took him in for his dental procedure, which was just supposed to be preventive, and I found that tooth resorption, removed that tooth, and then all of a sudden his coat was really soft again. So he had not been grooming as well because his mouth was hurting him, but that was the only sign that he had.
Yeah, and I've heard other stories of cats, for example, that are just they're having behavioral issues like eliminations outside of the litter box, and that's just kind of their way of communicating something's wrong, and we might not associate that with oral pain, but when we look and find these resorptive lesions and then treat it, we can then sometimes see that they will kind of return to their happy, healthy, normal behaviors using their litter box normally.
Yeah, I had a client too that had two brother kitties that started fighting all of a sudden. The only thing I could find in their physical exams was one of them had resorption, and we did his dental care and took care of that, and they went back to normal. So it was such a surprise. I was like, I don't think this is probably the cause, but let's treat it and see what happens. And it worked. So, or maybe it was just the weirdness of you came home smelling weird. I don't know what to do now.
Maybe that sometimes.
Yeah. So, and then another thing I'd like to talk about that we mostly see in cats, although we can see it in dogs, it's a little bit different, is Gingivostomatitis.
Yeah, so this is actually a pretty uncommon condition that is unfortunately one of the most severe oral diseases that we can see. It affects about 1% to 2% of cats, and it's characterized by severe oral inflammation extending from both the gums around the teeth all the way to the back, sometimes down into the throat, and it can cause severe inflammation, sometimes proliferation of tissue where it can almost look like masses growing in the back of the mouth, and the tissue can bleed. And I liken it to kind of having a pizza burn on the roof of your mouth. If you bite into like a hot pocket or something and burn the roof of your mouth, these cats get that kind of that feeling of burnt oral tissue everywhere in their mouth, and it can be excruciatingly painful to the point that they will no longer eat normally, and then they can start losing weight and have a lot of other health issues that follow from that. So it is one of the most debilitating and severe conditions that we see in cats, but fortunately it is very uncommon. Dogs get a similar but a little bit different condition. Stomatitis in dogs is usually caused by a sensitivity to the plaque bacteria that live on the surface of the teeth. So often in dogs, just doing a deep cleaning can make a world of difference for getting that inflammation to subside. In cats with this stomatitis, we don't really understand fully the cause of it. We think it's multifactorial. So there's likely viral components. Cats with things like calicivirus or other upper respiratory viruses seem kind of predisposed to developing this. Cats that live in multi-cat households where they're experiencing a lot of stress or potentially kind of passing viruses back and forth between them. We know that these are some factors that predispose cats to developing, or kind of those are factors that are correlated with stomatitis, but we don't really know what causes it. And so it makes it a little bit more challenging to treat. Unfortunately, we are left with the best outcomes that we see are with surgical treatment. So going in and extracting teeth in the areas of inflammation. And that can be quite a commitment from the owner's standpoint, having to put a cat through major surgery and help them recover through that. And then, of course, financially, that can be quite a lot to go through as well. So this is one of those diseases that, can require having long discussions with your veterinarian and coming up with a plan of action and understanding the prognosis kind of before going into it.
Yeah, that's one of the conditions where you'll see kitties actually stop eating. It's their mouth is just so painful, poor little things. So we talked about tooth fractures. Another oral health problem, I guess, would be actual jaw fractures would be something that you would also address.
Yeah, so these are not super common,
thankfully.
But we do see, though I would say the number 1 and 2 causes for jaw fractures that I see are hit by car animals, usually dogs, but sometimes cats as well, or animals that have been in an altercation with another animal, whether that's 2 dogs fighting or a dog getting attacked by wildlife I've seen, things like that. So usually this is involving some type of trauma. But sometimes we can also see pathologic fractures of the jaw. So jaw fractures that might occur when a little geriatric Shih Tzu jumps off of the sofa and bumps his chin on the floor, and it causes his jaw to break. And that's secondary to severe periodontal or gum disease, where there's been so much bone loss that the jawbone is weakened, and then it just takes a very small trauma for the jaw to fracture. So we can see kind of 2 different, on the spectrum of causes of jaw fractures, we can see severe trauma and then very minor trauma, and that often relates to what the underlying disease process is.
The overall health of the jaw. Yeah. And so what kind of treatments might you be doing for a jaw fracture? How do you fix that?
Right. So for those cases of the pathologic jaw fractures where it's secondary to really severe periodontal or gum disease, we often have to go in and extract teeth in the region of the fracture to get rid of the source of chronic inflammation and infection. So it can sometimes require staged treatment where we start by either stabilizing the jaw and getting it to heal and then going back in and extracting teeth, or conversely, sometimes we go in and extract teeth, allow the soft tissues to heal, and then go back at a later date and try to get the jaw in alignment and get that to heal together. For cases of more acute trauma, things like a hit by car or a young, healthy dog that gets into a fight with another dog and breaks its jaw, for those, we have a variety of different tools to try to repair the jaw fracture, kind of ranging from minimally invasive to much more invasive procedures. So if possible, we like to use the teeth as kind of a splint where we can attach wires and acrylic composite material to kind of hold the jaw in alignment and kind of act as like a natural splint by attaching that to the teeth. That's kind of the preferred option, but sometimes there aren't teeth in the right locations, or the fracture might not be amenable to that type of repair. And then so we're using things like metal plates and screws. That's the most kind of more invasive repair technique, where we actually have to go in and expose the bone and put little screws and things in it. Or sometimes we do an even less invasive approach of putting a nylon muzzle or like a little cloth supportive muzzle on the animal and leaving that on for a period of anywhere from 4 to 8 weeks to allow the jaw to kind of heal in alignment.
That is really cool. So let's talk about one of the more sinister things that we probably see would be cancer in the mouth or masses in the mouth.
Right. And anytime I see a mass, or anytime an owner sees a mass in the mouth that's new or is changing, then that definitely would warrant having a veterinarian look at it. There are a lot of different types of masses. Some can be benign, but many can be more aggressive or potentially even malignant cancerous masses. And it can be quite difficult to tell the difference at times. So in general, there are kind of a couple of different characteristics that masses have that make me think of them as being potentially more aggressive or more in need of urgent treatment. And those would be things like a mass that is rapidly growing. So if it's doubling in size in a matter of days or weeks, that's a cause for concern. If the mass is kind of growing inward and invading tissue, causing teeth to shift position, or if there's a ulcerated, bloody looking area, that can be a sign of either infection or a more sinister process like a cancerous mass. So if we are seeing any of those characteristics, even for other masses that might not have those aggressive characteristics, it still warrants having a closer look, documenting that for monitoring purposes. And sometimes when we're doing dental treatment under anesthesia, we might consider biopsying, whether that's just obtaining a small piece of tissue to get a diagnosis or trying to remove the abnormal tissue in its entirety. Will kind of depend on where it's located, the size, the tissue quality, a whole variety of factors. But often our first step is going to be recommending getting a piece of tissue so that we can send it to a pathologist to look at under a microscope and give us a diagnosis whether or not it is something that we should be worried about.
Okay. We've mentioned a couple of signs, and some of those would be kind of more obvious to people. An animal stops eating, that sort of thing. But what other signs might a person notice that their dog or cat is having some significant discomfort in their mouth that warrants getting checked out?
Yeah, so the most common sign, unfortunately, is no sign at all. Animals are, once again, very good at hiding their discomfort. But subtle things that you might notice include increased drooling or tilting the head to the side when chewing. That could be indicative of discomfort in one side of the mouth where the animal is trying to kind of shift the food to the other side where things are more comfortable. Things like acting more withdrawn or hiding more, that can be a very subtle behavioral change that could indicate some discomfort. Or sometimes things like decreased grooming behaviors, or dogs that used to want to play tug with toys a lot might kind of no longer want to play with their toys as much, or they might kind of have different type play behaviors. So a lot of subtle behavioral changes can be actually due to oral discomfort.
I find occasionally kitties will drop their food, or even, and this is more, I think, with kitties with stomatitis, they'll hiss it. They'll try to eat and then they'll hiss at their food.
Or run away from their food bowl. Yeah. I've heard of that too.
Yeah, so rare, but
those are usually when we're seeing much more severe oral pain. But those are kind of classic signs that there's a problem in the mouth.
And then what about bad breath?
Bad breath, of course. So I hear that animals are supposed to have, breath that smells a little fishy or dog breath, but often there's actually a component of that is abnormal due to the abnormal pathologic bacteria growing in those little pockets around the teeth. So if you're noticing changes in breath and any type of bad breath, I think it's warranted to have your veterinarian take a look in the mouth, kind of assess and see if there appears to be evidence of gingivitis or inflammation of the gums. That could indicate that there is some periodontal disease going on below the gum line. We're starting to get kind of changes in the bacterial population into those more anaerobic bacteria, one bacteria that produce different scents that can smell a lot worse. And so the smell is actually often a key indicator that something has changed and that there might be a problem developing in the mouth.
Okay, so let's talk about some things that people can do at home for regular dental health care for their dogs and cats.
Yeah, so number one thing is to try to look in your animal's mouth periodically. This is going to help familiarize you with what is normal and more readily identify abnormalities and kind of notice problems sooner so that we can hopefully treat them and address them more promptly. So I recommend at least once a week lifting up your animal's lips, taking a look at the teeth, the gums, and everything. And kind of, this is something that is a gradual process. It doesn't just happen overnight that you can just open your animal's mouth and get a good look at everything. Even me with many years of training, there are still some pets that are just almost impossible to get a look in there. So I know that is asking a lot for some pet owners, but that's kind of step one, is try to get used to taking a periodic look in your animal's mouth, familiarizing yourself with where the teeth are positioned and kind of what things look like. Number two, kind of, if there's one strategy that's going to make the biggest difference in helping minimize progression of gum disease, I would say toothbrushing by far is the best method. This is why people brush their teeth twice a day. Our dentists are telling us to brush our teeth for 2 minutes twice a day. As a veterinary dentist, I'm happy if my clients are brushing their pets' teeth for 10 seconds once a day. They're already ahead of probably 95% of pet owners, but every little bit helps. And really what the toothbrushing is doing is mechanically disrupting the plaque biofilm. So that bacteria is building up on the surface of the teeth and forming all sorts of a little microenvironment and community that's going to cause a lot of the problems. And if we take our toothbrush and rub the bristles against the gums and the teeth, it's going to actually help remove some of that biofilm buildup, and that's what's going to help slow the progression of disease the most. Toothbrushing can be aided by things like toothpastes. I recommend using a pet-friendly toothpaste that is, there's a variety of different companies out there, and they make flavors such as poultry or seafood or beef, flavors that aren't necessarily very appealing to the human, but for dogs and cats, they love the flavors of these toothpastes. Some of the toothpastes are labeled enzymatic, and those enzymes are kind of helping break down some of the biofilm as well, but I think that I use the toothpaste more as a reward for allowing the toothbrushing behavior, and I think that the mechanical motion of the toothbrush bristles against the teeth is going to be exponentially more effective than any enzymatic activity in the toothpaste. So I'm even happy with just water on a soft bristled toothbrush, or some people will use like a little finger brush or even like a gauze, anything to get in there and kind of rub along the surfaces of the teeth and gums so that we can mechanically remove as much debris as possible. So toothbrushing is, I think, kind of the gold standard, best you can do. After that, there are a variety of other products that have been designed to help maintain oral hygiene that are maybe less effective than toothbrushing, but do have some degree of benefit. Some rely on mechanical chewing behaviors, so things like dental treats or dental diets that have kind of larger kibble size, so animals have to chew them a little bit more. Those are good options, especially in some of the animals that don't allow as much toothbrushing. Having other strategies in addition to the toothbrushing is great. There are also a variety of products that rely on more of a chemical means of inhibiting plaque buildup. So they might have, there might be water additives or gels that are applied to the teeth that are designed to help minimize the progression of the gum disease. And ultimately, I recommend looking at the Veterinary Oral Health Council website as a good reference. This is a group of veterinary dentists and dental scientists that have come together to establish kind of some criteria for evaluating dental hygiene products to determine if they are truly effective in doing what they're advertised to do. And so on their website, they've published a list of products that have earned their seal of acceptance, meaning there's been some degree of scientific testing to show that these products are beneficial. There are a lot of products out there. I go to the pet store and I see like literally an entire aisle of dental chews. And so it can be hard to know which ones are actually going to be effective and which ones are more of a gimmick. And so that website, vohc.org, is a good reference.
And I'll put a link to that in the show notes so you guys can click on that and have a look.
Yeah, for sure.
Okay, excellent. And I do want to point out, you mentioned the pet safe toothpaste. People should not use human type toothpaste for animals because those are not intended to be swallowed.
Correct. So the fluoride that's in human toothpastes is designed to help prevent cavities. And as we talked about a little bit earlier, cavities are much less of a concern in animals, so they don't really need the fluorinated toothpaste. And also, the human toothpastes have foaming agents that kind of make it all bubbly when we brush our teeth. And most animals find that foaming feeling very aversive, and it can actually make them much less likely to let you brush their teeth. So avoid human toothpaste. I think even water is going to be better than that.
Or I tell some of my cat clients tuna juice or chicken broth.
Exactly.
if they don't like the toothpaste for pets,
Yeah, when you're getting a pet used to the toothbrush, anything that they really love flavor-wise is a good option, even if it's something like peanut butter or squeezed cheese. Anything that's going to make them enjoy the toothbrush a little bit more is totally fine.
And it's also a good idea to take it initially in baby steps of training. So don't try to sit down and brush that whole mouth in the first go, because it's probably not going to go well.
Right. I recommend at least 1 week, if not 2 or 3 weeks, of just introducing the toothbrush without even trying to put it in the mouth or open the mouth. Just let the pet sniff, lick, chew at the toothbrush. Just kind of let them engage with the toothbrush without forcing it upon them.
And then kind of gradually work up to maybe brush one tooth and then give a little treat, and then kind of work it up to being able to do the whole mouth.
Right.
And not trying also... Do you recommend people try to get the inside, like the tongue side surface of the teeth, or just the cheek side?
In an ideal world, I would say get every surface, but I am more than happy with just focusing on the outer aspects. I know that that's enough of a struggle, and that's where the majority of the tartar does build up, on the outer aspects. So that's where you're going to be making the most effective and most beneficial difference is by focusing on brushing those outer aspects kind of between the cheek and the teeth. It's okay if the pet's chewing as you're brushing, because that will get the bristles into the little nooks and crannies and spaces between the teeth. And then if you get to a point where you're really comfortable and your pet is familiar with having the toothbrush in their mouth, then you can start to work on kind of opening the mouth or flipping the toothbrush around and getting the inner aspects. But really start with toothbrushing 101, just focus on the outer aspects of the teeth.
Excellent. Awesome. Okay. So lots of stuff that we can do for preventive healthcare at home. But then there will come a point when our pets need professional dental care. So now general practitioners like me do quite a lot of dental care, and we're generally doing our tooth root x-rays, a whole tooth x-rays, and an oral exam, and we're scaling and polishing, and we're often in a general practice setting extracting teeth that are significantly diseased. And then there's next level care, which would be what you, Dr. Schneider, would be taking care of. So we'll talk a little bit. Let's talk first about what happens during just a professional dental cleaning. What does that look like? Why do they need to be under anesthesia? Can it be done without anesthesia, which is advertised in a lot of places?
Yeah, so there's a lot that happens during a professional dental cleaning. And you might hear it referred to as a COHAT, which I believe stands for Complete Oral Health Assessment and Treatment. Even though the acronym is a little bit hard to remember and people don't really know what you're talking about, I think it does do a good job of kind of pointing out that not only are we kind of cleaning the teeth, but we're actually assessing the whole mouth and treating dental disease that's present. So it really does, unfortunately, need to be under full general anesthesia for us to get all that we need to accomplish accomplished. We see anesthesia-free dental procedures advertised, and I think those are really the only benefit of those type of procedures is cosmetic. So they're just kind of removing any tartar that's built up on the surface of the teeth kind of above the gum line, not anything that's in the pockets in the areas that are actually causing problems. That requires us to take instruments and kind of go up under the gum line, things that animals aren't going to sit still and let us do a very good job of when they're awake. So we really do rely on having our patient under general anesthesia to be compliant, to allow us to look in all the surfaces, clean everything effectively. And also it kind of makes the whole experience less stressful for the pet too. They're not going to have negative associations with having their mouth manipulated. They're not going to remember anything. When they're under general anesthesia. So we kind of start by, when they come into the clinic, we give them some pre-medication, so usually something to make them sleepy and kind of just relaxed. And then we place an IV catheter. Usually my nurse will shave a little spot on a front leg. Sometimes we have to use a back leg. Sometimes it takes a couple tries, so we might shave a couple legs. But we place that IV catheter to allow us to give injections straight into the vein. And then also our patients are hooked up to IV fluids while they're under anesthesia. So they're getting the IV fluids to help maintain their blood pressure and kind of just keep us at a good plane of anesthesia. And so we do all of that in preparation, and then we give them an injection of a medication that actually does put them fully under anesthesia to make them go to sleep. At that point, we actually will intubate or place a tube down their throat. And this is really important in dental procedures in animals because they have lots of tartar buildup, and when we're removing that, the little bits of tartar kind of fly everywhere in their mouth, and we don't want it going into their airway and causing them to get a infection like pneumonia. So by having the tube down their throat, we're protecting their airway, and it will allow us to maintain a safer plane of anesthesia as well. So this is all just kind of in preparation. So at this point, they're under anesthesia. Now the actual true dental assessment begins. So in my practice, we like to start with the diagnostics. So we take full mouth dental x-rays most of the time. Occasionally, if we have had recent dental x-rays, we might do more targeted x-rays of problem areas. But most of the time, we don't know what's going on below the gum line. And if we haven't taken x-rays within a year or two, things could have drastically changed. So most of the time we are going to be taking x-rays of every single tooth in the mouth. And then also I take a little dental probe, much like when a person goes to the dentist. I use that little probe to check around every tooth for any pockets, areas of attachment loss, any fractures or abnormalities in the tooth surface. And while I'm doing that, my assistant's kind of taking notes for me, writing down all the findings. And then once we have the x-rays and the probing and charting findings, at that point, my assistant gets started on cleaning the teeth with ultrasonic scaling and polishing. So this is the part where in a human clinic, your dental hygienist is doing the scaling and polishing. while my assistant is doing that, I'm actually looking at the x-rays and my chart from the probing findings and making a decision on a tooth-by-tooth basis whether or not any additional treatment besides cleaning is indicated. So for example, if we find an area where there is some attachment loss on the tooth, we kind of assess that as mild, moderate, or severe attachment loss. And if there's maybe mild or moderate attachment loss, we might elect to do a procedure such as root planing, or basically a deep cleaning of that tooth. Or if there's severe attachment loss, that might be an indication for extraction. I like to have the cleaning done in its entirety before I do any extraction so that I'm operating in as clean of an environment as possible. And so after we've done the cleaning, that's when I kind of jump back in and do any additional treatments. And then we kind of make sure everything is completed. We take x-rays after any extractions or any type of surgery that's done on the jaws to document and kind of make sure we've gotten all of the roots and everything looks good. And then we make sure to check the airway, and then we wake them up from anesthesia. And usually we keep them for a little bit of time to make sure they're maintaining their vitals, maintaining a nice warm body temperature, and then we send them home. And usually it takes, might be a full day from start to finish, but I would say the majority of our patients do great, and they go home that same evening, and by the following day, they're on the road to recovery, already feeling better.
Mm-hmm. I find a lot of animals are even eating during recovery in the hospital, even when they've had multiple teeth removed.
Right.
They're so comfortable with all the nice pain control and everything.
Exactly. Some of the medications do have a side effect of making them a little bit extra hungry. They wake up from anesthesia and they have been fasted overnight going into surgery. So they wake up hungry and their mouth is comfortable and they're happy to eat right away.
So, and how often for most pets do those kinds of procedures need to be done?
It does vary a little bit from animal to animal, especially based on the level of home care that they are receiving. So for animals that are getting their teeth brushed daily, we might be able to kind of prolong the intervals between anesthetized dental cleanings. But I would say on average, about annually is the kind of starting point that I recommend. So usually your primary veterinarian is going to be checking your pet's mouth at their annual wellness exams. And it might be as soon as 1 year or sometimes maybe 2 or 3 years of age, they might already be mentioning, I think your pet needs an anesthetized dental cleaning, and that will allow us to also kind of get baseline assessment. And then everything that happens during the anesthetized dental procedure gives us some information. If we're already seeing a lot of disease present, we might need more frequent anesthetized dental procedures. If we're looking to just kind of get a baseline cleaning, I would say on average that can range anywhere from every 6 months to every 24 months is probably even pushing it at the high end.
Okay, and then are there variations between different breeds?
For sure. So large breed dogs in general are much more likely to have tooth fractures and less likely to have periodontal or gum disease. And small breed dogs are much more commonly affected by periodontal disease, gingivitis, and kind of tooth extractions and tooth loss due to those issues. But periodontal disease really does affect all animals. And so that's the number one thing that we're trying to prevent with our routine dental cleanings is kind of going in, removing that plaque and calculus or tartar buildup. But then we're also at the same time assessing for other abnormalities like broken teeth and other problems, like looking for lumps, bumps, masses in the mouth too.
And for those teeth that do need to be removed, so if you've decided that this tooth, there's no fixing it, we've got to extract this tooth. Can you walk us through a simple extraction and a surgical extraction, kind of what that involves?
Sure. Yeah. So first, the main indications for when your veterinarian is recommending extraction, that usually means that there's either greater than 50% attachment loss. So at that point, the tooth has some mobility. It's kind of wiggly and causing discomfort, or it might have really deep pockets that are unable to be fully cleaned. And we know that bacteria is going to set up further inflammation and infection. So when we're extracting a tooth, it's usually because of some type of problem, or it's a dead tooth because the pulp has been exposed, something like that. The anatomy of the tooth determines whether or not we need to do a surgical versus simple extraction. So a simple extraction is usually used in single-rooted teeth, like the small incisors, the little ones at the front of the mouth, or sometimes other teeth that have very short roots. And for simple extraction, this is as the name implies, pretty easy to do. We actually just kind of wiggle the tooth out. We can use a luxator or elevator, an instrument to kind of go in between the space between the tooth and the jawbone and cut the periodontal ligament, that structure that attaches the tooth to the jawbone. And then we just kind of wiggle the tooth out, clean out the tooth socket, make sure it's all the tissues look good. And then I usually will put one or two little stitches at that in the gums to hold the tissue closed over the tooth socket. Sometimes, like in human dentistry, often with a simple extraction, the tooth socket gets left open to heal closed on its own. And in animals, so in people, we can kind of rinse the area. We can preferentially chew on the other side of our mouths, so it's a little bit more acceptable. In animals, because they don't really listen when we tell them, hey, don't chew in that area, and they're not going to let us be rinsing the area regularly. Putting the stitches in does help kind of just keep the area clean and deflect any food debris from getting into the tooth socket. So most of the time, even with a simple extraction, my patients do go home with little stitches in their mouth. The stitches are dissolvable. So I'm most often using a suture material called monocryl, but some other types of suture materials exist as well. And these kind of break down naturally over a period of several weeks. And the stitches can kind of tickle like having a hair in your mouth. So I warn my patient or my clients that they might see increased licking or kind of weird facial movements for the first couple of days. And then sometimes again, a few weeks later as the stitches are loosening up. But those behaviors will resolve once the stitches come out. For surgical extractions, this is what we do for multi-rooted teeth or teeth like a canine that has a very, very large root and the root is curved so it doesn't just come straight out. So for surgical extractions, we are usually making a small incision in the gums to kind of move the soft tissues away from the underlying jawbone. And then we use the dental burrs on the high-speed handpiece. So that's the drill that that a lot of people have negative associations with the sound of that. But we use that little drill to remove some of the bone around the tooth root so that we can more safely kind of wiggle it out. And then we cut the tooth into individual roots and take the roots out individually. After the roots are out, then I use a different burr on that high-speed handpiece to smooth down the bone and make sure we're not leaving any sharp edges. And then we stitch the gums closed over the tooth socket, and it heals very quickly, actually. Usually in about 10 to 14 days, the gums will have healed over the empty tooth socket. And then over time, the body's kind of remodeling and the tooth socket's filling in with new bone. And in a matter of a couple of months, it will be almost like there was never even a tooth there to begin with.
It's amazing how quickly the bone regrows.
Yeah.
I've had to do a recheck X-ray on a kitty. I think it was 3 or 4 weeks post-op. The cat was having some weird signs, so we went ahead and took some X-rays. The bone was completely healed already. You couldn't even tell we had taken teeth out. It was amazing. I do want to say she just made that sound really easy and simple. And I want to say there is a reason for the phrase, it's like pulling teeth.
Yes.
And I say that partly because oftentimes clients will say when they're dropping their pet off in the morning for their dental procedure, I don't want any teeth removed that don't need to be.
Yes.
And I think we both want to assure everyone right now that there is no veterinarian out there that ever wants to remove a tooth that doesn't need to be removed.
No, it is not easy. It can be very challenging and very trying of your patients. So generally, we want to try to save the teeth too. And so when we're recommending extraction, it's because there actually is a true need for it, and it's going to help improve your pet's quality of life.
Yeah, absolutely. So when we have elder animals, dental disease does tend to progress over time. So we see it a lot in our older patients, often geriatric patients. Are they still candidates for this kind of procedure?
Most of the time, yes. I have many patients that are in double digits age that will come in for annual anesthetized dental procedures, whether that's just a cleaning or sometimes if they've never had dental care, they might actually be ones that if they're 13 years old and have never had an anesthetized dental cleaning, they might need 20 or more teeth extracted because they've had such significant progression of gum disease. So it's very common for us to anesthetize geriatric animals, and sometimes we do long anesthetic procedures in the range of hours long, and ultimately, it's something that we kind of have to take into consideration the animal's whole health. So we're usually recommending full blood work, like a complete blood count and chemistry panel. Sometimes your veterinarian might also recommend urinalysis or chest x-rays, trying to screen for any other underlying health issues that could put them at higher anesthetic risk, and kind of know where we're at, so it helps us to choose the best drugs for anesthesia to make everything as safe as possible. But many patients do have underlying issues like heart disease. I have a lot of my patients with mitral valve disease that's very gradually progressive as they age, and their periodontal disease is gradually progressive as they age. And so we kind of have a knowledge going into the procedure that we want to try to minimize anesthesia, things like that. But yeah, ultimately working with your primary veterinarian on a case-by-case basis to determine whether your animal will benefit and kind of weigh the risks and benefits. But most of the time, we can very safely administer anesthesia, and our patients will be better off having had their oral health taken care of.
Mm-hmm. And I also want to mention, we talked a bit about the anesthesia. We're also doing a lot of monitoring during anesthesia. We're, hopefully every vet is doing this. I know there are still some hospitals out there where they're not doing as comprehensive, sort of modern drug protocols and monitoring. But so you want to make sure, you want to talk to your vet about what they're doing. But in general, we're monitoring blood pressure, we're monitoring an ECG, so the electrical activity of the heart. Their end-tidal CO2, which is the CO2 that's coming out in their breath, their blood oxygen level, all that kind of stuff we're monitoring throughout the procedure. And that becomes, that's important for any patient, but especially for like a geriatric patient with underlying heart disease, all that kind of stuff. You do want to make sure that's the kind of care that your patient is getting. And I think most vet hospitals are up to standard on that kind of monitoring and intensive care at this point.
Yeah, I think having a dedicated nurse that is monitoring throughout the procedure is really critical, and that is the standard of care for most hospitals at this point.
Yeah, thankfully. So I have a lot of clients that worry about their animal not being able to eat if we remove teeth. And my response to them is usually they're going to eat better without painful teeth in their mouth.
Exactly.
So let's talk about pain management of when we're taking out teeth and for the recovery period.
Yeah. So, often these patients with chronic periodontal disease have chronic low-level discomfort, especially if they have teeth that are loose and kind of moving every time they chew. That's kind of pulling on nerve endings. So they actually are kind of experiencing pain before they have the dental procedure, and so often they will have tremendous changes in behavior and act more youthful after the procedure because they feel better. But we do try to address their peri and post-operative pain with a variety of different modalities. So first we give nerve blocks at the time of the dental surgery if they are going to be having extractions, just like when a person has a tooth extracted or if you have a cavity filled or something. We give an injection of a medication like lidocaine or bupivacaine, something that's going to numb the area. The nerve blocks that I use typically last somewhere in the range of 12 to 24 hours. So that nerve block will be on board as the patient's waking up from anesthesia and as they go home. That being said, it can cause them to have maybe a little bit of increased drooling, or some animals will rub or paw at their face when they wake up from anesthesia because their mouth is numb. So that's kind of one thing to be aware of. But I would rather have them have a numb mouth than a painful mouth.
Absolutely.
In addition to the local nerve blocks, when we're placing animals under anesthesia, we're often giving them things like opioid medications to help lower their anesthetic requirements, but those have a benefit of also providing pain control. So those medications will also be on board. And then usually I'm prescribing some type of postoperative pain control for a matter of a few days, typically, sometimes up to a few weeks if it's a more major oral surgery. But my number one go-to for postoperative pain control is typically non-steroidal anti-inflammatory drugs, NSAIDs. So in people, this would be like an aspirin or an ibuprofen, that kind of thing. In animals, we have specific NSAIDs that are designed for use in cats and dogs.
Don't give them ibuprofen.
Yeah, don't give them those medications.
It doesn't work the same.
Just that class of medication is going to be beneficial in that it will help reduce pain and inflammation, and so it will address a lot of the dental pain. But unfortunately, there are a lot of animals that aren't good candidates for using those NSAIDs because they have underlying liver or kidney issues, something that could potentially put them at increased risk. So we're using medications to address nerve pain like gabapentin or pregabalin, or we'll use opioid pain medications. So we can use a variety of different things. And then sometimes we'll use antibiotics if there is an active infection or poor tissue quality. And those antibiotics, if there is an infection, that will help address kind of eliminating the infection, will also help with pain control as well.
Mm-hmm. Wonderful. So, and that's pretty common, regular, everyday dental care for dogs and cats that we're doing in veterinary hospitals. All of that stuff is pretty frequently done, kind of
on the daily basis.
Yes. What kind of disease processes might we see that would require a more advanced sort of procedure beyond a tooth extraction? So maybe it's a case where an extraction is an option, but the client really wants to save the tooth for one reason or another, or it's something totally different where you might need to be doing some other type of procedure that a general practitioner really isn't going to do.
Yeah, so sometimes I get referred cases because of the extent of oral surgery. So if it is a geriatric animal with severe periodontal disease that might need all or most of its remaining teeth extracted, then a primary veterinarian might refer to me just because they want to kind of minimize anesthetic time and just make it as efficient as possible. Or I also get patients referred for more advanced dental procedures like root canal therapy for treatment of fractured teeth when we want to save the tooth or keep the tooth in the mouth. Or sometimes I'll have a single tooth affected by periodontal disease with attachment loss that is amenable to repair. So I might get referred a patient for advanced periodontal surgery to save a tooth that has a focal periodontal pocket. And then also getting referred cases of trauma. So things like the jaw fractures or a tooth that's been luxated or kind of pulled out of its socket. We see that unfortunately pretty commonly when dogs bite car tires.
Oh, ouch.
But that would be something that might require a little bit more urgent attention. And then oral tumors or cancerous masses in the mouth that require a much more radical surgery to remove in its entirety will also often get referred to me. So there are a wide variety of dental and oral surgery procedures that we're able to offer.
Okay, so what type of procedure? So if we were going to do like a root canal, is that pretty much the same as a root canal in a person?
It's very similar to root canal in people. So the idea behind a root canal therapy is that the tooth is already essentially non-vital or dead. Sometimes it's in the process of dying, so the tooth has fractured and the pulp has been exposed and bacteria has gotten in. So there might still be some degree of pulp tissue present that still bleeds and causes discomfort, but we're going to go in and remove all of that inflamed, diseased tissue and clean out the tooth, actually sterilize the tooth from the inside and seal it, and then that will hopefully prevent bacterial invasion and infection from developing down the road. And so We have a very similar success rate with root canal therapy in dogs as we do in people. So about 90 to 95% of teeth treated with root canal therapy in dogs will go on to remain successful with no evidence of inflammation or infection developing, and they can keep that tooth for the remainder of their lives. In about 5 to 10% of cases, we might see at follow-up exams evidence that the root canal has failed. When we take an x-ray, we might see bone loss around the root or evidence that there has been ongoing infection, in which case then we'd have to either retreat with a follow-up root canal therapy or extract the tooth or do surgical endodontic therapy, kind of doing a root canal in reverse. But those are very, very rare because we do have such a good success rate with standard root canal therapy.
And then is there ever really an indication to do like a crown or a filling? Do animals need those?
Yeah, so a filling will be part of the root canal invariably. When we remove the pulp contents, we actually have to make a little hole in the tooth to put our files in and get all of the abnormal diseased tissue out of the tooth. And then we pack the tooth with the inert material that's kind of a rubbery-like substance called gutta percha, and then we do put a little filling over that. So that filling is usually a pearl-colored composite that looks like the tooth, so it kind of blends in. You wouldn't notice it. And depending on which tooth is broken and how many roots that tooth has and where the access points were created, it might have anywhere from 1 to 3 fillings in a tooth that's treated with root canal therapy. The metal crown that's placed on the tooth after root canal therapy is optional most of the time. And in our companion animal pets, I would say most of the time we don't do a full metal crown because of the added expense and the added procedure. It does require an extra anesthetic episode, albeit brief, to cement the crown in place following the root canal. So the idea behind the metal crown is that it's kind of adding a hard outer shell to help prevent the loss of the filling and help protect against ongoing wear or abrasive forces. But it is still possible to break a tooth below the full metal crown, or it's still possible that the root canal could fail. So the metal crown isn't fail-safe. It isn't a guarantee that you're never going to need to treat the tooth again, but it does provide some level of protection to the crown of that tooth. And so in working dogs in particular, so dogs that are apprehending criminals and need their big canine teeth to be strong and kind of scary looking, they will often get full metal crowns. Or in dogs that have fractured their upper fourth premolar, one of their largest chewing teeth, often when that tooth fractures, it's in a pattern where kind of the whole side of the tooth is sheared off. Sometimes that's referred to as a slab fracture. And if that fracture extends below the gum line to involve the root of the tooth, that makes the tooth a much worse candidate for root canal therapy because it might develop attachment loss, gum disease, and need to be extracted in the future. But sometimes if the fracture doesn't extend below the gum line, but maybe just near the gum line, we can actually put a metal crown on the tooth after we've treated it with a root canal to kind of recontour the tooth to a more normal shape and help prevent progression of gum disease. So it is on a very much a tooth-by-tooth basis and an individual patient basis whether or not we recommend a metal crown and whether or not it's necessary or going to provide benefit.
Interesting. Dogs with big metal crowns on the canine teeth can be a little intimidating looking. It just gives them a more badass kind of look.
For sure.
Okay. So now what about orthodontics? Do we need braces ever in pets? Is there a reason?
So orthodontics are certainly indicated in some animals, surprisingly. Dogs and cats can develop malocclusions or inappropriate alignment of their jaws or teeth. And often these are identified during development. So at the puppy and kitten wellness exams, your primary veterinarian might notice that your puppy's has a tooth that seems out of alignment or that their lower jaw seems relatively short compared to their upper jaw. They might notice things like that and then refer your patient to a veterinary dentist for evaluation and potential treatment. The number one concern when we have a malocclusion is whether or not the animal is able to have a comfortable and functional bite. So if they have teeth that are positioned in a way that every time they bite down, a tooth is poking into the roof of the mouth, or it's poking into the gums and causing the gums to bleed, and it's uncomfortable, then that's something that we definitely want to treat. We want to try to make the mouth more comfortable by either removing the tooth that's causing discomfort, or moving it into a different position, or potentially changing the shape of the tooth. So orthodontics is just one method we might deal with a malocclusion. Orthodontics, by definition, means we're kind of moving the teeth. And so this is something we do for if there's a single tooth that's out of position and causing problems, or if there are if the teeth have enough space to move into a position that can make them more comfortable, then we might put an appliance, some type of device, whether that's braces or an inclined plane that's made out of a composite or acrylic type material. There are lots of different strategies we can use to kind of shift teeth, but orthodontics does require often multiple anesthetic procedures to put the appliance on, make adjustments, and remove the appliance. So orthodontics does require a very particular set of people and patients that are willing to go to the effort to kind of keep the tooth and move it over time. Mm-hmm. So instead, often we're doing more kind of one and done type treatments, like going in and removing a tooth in its entirety, especially if it's a small tooth, like a baby tooth that never fell out, that's causing crowding. We might just recommend going in and removing the baby tooth. Or sometimes we have a tooth that is a large, highly functional tooth, like a lower canine tooth, the big fang teeth on the bottom jaw in a dog, that might be poking into the roof of the mouth, and it might be positioned that it's not a good candidate to try to move it because there's not a good spot to move it into. So instead, we might consider actually cutting part of the crown off, making the tooth shorter so that it doesn't poke into the roof of the mouth. But we have to do that in a very controlled environment to keep the tooth alive. So we actually do a special procedure called vital pulp therapy, where we put a little filling on the tooth when we cut into it. So there are a variety of different procedures that we can consider when we're dealing with malpositioned teeth, orthodontics being just one among several different possible treatment options.
That's cool stuff. It's great. Okay, and then we talked a little bit about tumors in the mouth, and you mentioned some more aggressive surgical procedures. Yeah. Can we talk a little bit more about what types of treatments, like what types of cancer do we see in the mouth as far as malignant cancers, and what kind of treatments might be options? Yeah,
so oral cancer is pretty common in dogs and cats. I think I'm probably not going to give the right statistics, so I'm not going to try. But when we identify an oral tumor in the mouth, one of our first questions is, what is the diagnosis? Is it something that it can spread elsewhere or metastasize? And if so, then we tend to treat it a little bit more aggressively. Or is it a mass that's going to invade locally? So even if it doesn't, it's a type of tumor that can't spread elsewhere in the body, some of the tumors can still be very locally aggressive and invade into the jawbone and cause a lot of pain and discomfort. So those in masses like that, usually our primary goal is to go in and remove the mass in its entirety if possible. To do this, we're often doing ectomy procedures, maxillectomies, mandibulectomies, or removing a portion of the underlying jawbone. But sometimes we see other types of tumors that are soft tissue masses, like on the lips, for example. So we might not actually be doing any surgery with the jawbone, but we might be doing some lip and cheek tissue removal and some kind of facial reconstructive plastic surgeries type procedures. So there's lots of really interesting surgical techniques, and it can get very advanced very quickly. We also do things like cleft palate repairs as another example of pretty advanced oral surgery. But for the oral tumors, usually what happens, first we like to have that definitive diagnosis before we make our ultimate treatment plan, because we want to know how aggressive the tumor is and how much normal looking tissue we need to take. So we always try to get quote unquote clean margins or a rim of normal tissue around all of the abnormal cells when we remove the tumor, because we know on a microscopic level there probably is more tissue invasion than what we can see with our eyes. And so we go in and remove, we usually will make a 1 centimeter margin around oral tumors that are things like a squamous cell carcinoma or a malignant melanoma. 1 centimeter margin might be our goal. For a more aggressive, locally aggressive behaving tumor, fibrosarcoma, we actually try to get 2 centimeter margins. So for those procedures where we are potentially removing a lot of tissue, a portion of the underlying jawbone, we want to get more diagnostic imaging performed beforehand. So often we're recommending a CT scan of the head and neck area that allows us to obtain images in multiple planes and dimensions and kind of create a 3D model of the skull and the head and make our surgical plan beforehand. But the CT also has the benefit of allowing us to assess other soft tissues, things like lymph nodes, salivary glands, and that can provide us more information too when, for example, when we look at the lymph nodes, if they have abnormalities on the CT scan, that might make us more suspicious of metastasis or spread into those lymph nodes. So then we might take a biopsy of the lymph node as well. So getting some advanced imaging like a CT scan. MRI is more reserved for neurologic issues. It can be used for some oral tumor planning, particularly soft tissues like at the tongue base is one where we might actually consider an MRI instead of a CT. But most of the time for my oral and maxillofacial surgeries, my CT scan of the head is the go-to imaging modality. We also often will recommend either chest x-rays or if we're doing a CT scan of the head, extending it to also take a CT scan of the lungs, once again looking for spread of cancer there, and then staging, kind of doing things like abdominal ultrasound to screen for any abnormalities or tumor metastasis there as well. I don't know if I answered the question. I kind of got sidetracked.
No, that was definitely that was just what I was asking for. So we definitely have a lot of options, even with nasty bad things like cancer in the mouth. There are still options for treatment in a lot of cases. I know some cancers in the mouth have a worse prognosis than others. Like you mentioned, squamous cell carcinoma in cats. That's a very bad prognosis in general.
Yes, unfortunately,
sadly.
In dogs, however, we sometimes even with malignant or cancerous masses, we can actually get curative outcomes where we are able to remove the mass in its entirety with clean margins, and we follow up long-term with just monitoring, taking x-rays periodically, and many patients will remain tumor-free for the rest of their lives.
That's wonderful. So do you feel that dental care in general has a significant impact on an animal's quality of life?
Yes, I think that it can improve their overall systemic health long-term. So if we have chronic oral inflammation, as we mentioned way back at the beginning of this episode, that can cause a lot of other underlying health issues. And so by maintaining a nice, healthy oral environment for the pet's entire life, we're really going to help keep them disease-free in other aspects as well. And then also, quality of life. I think dental disease is a very common source of chronic pain and discomfort, and it's often neglected or not even noticed because it's so chronic and so insidious. And so if we're able to kind of treat and improve their oral health, many patients will have almost 180-degree turnarounds in personality. Sometimes patients that are really grumpy or don't like to interact with other animals will become very outgoing and playful and social once their mouth is no longer bothering them. And many, many times I get owners tell me, it's like my patient is a puppy or a kitten again. They've just gained so much energy after having their dental disease treated. So I definitely think just in the anecdotal stories I hear time and time again, that it really does make a huge difference in their quality of life.
I had a 21-year-old kitty that we did a dental procedure on. He needed a lot of teeth extracted. And when I called to check in a few days later, the client said exactly that. She's like, I can't believe he's running around like a kitten. He's like a whole new man. And I was like, oh my gosh, 21 years old. And it's hard to make that decision, and especially in geriatric patients, to go ahead and do the procedure. But if they're otherwise overall healthy, it really can make a tremendous impact on them. I think it's worth it. So I want to cover just a couple of myths. I think we've already kind of covered a lot of them. I had a few things written down about bad breath and the dangers of anesthesia, but there are a couple of other kind of myths that I just want to briefly cover. So one of them, I don't know if this is a myth or just a question, but if they eat hard kibble, that's brushing their teeth. And the flip side of that is eating soft food, like cats eating canned food, that's bad for their teeth. Can we just clarify that?
Yeah, so I think we don't have enough data to know 100% for sure. I think our general understanding is that some chewing does provide kind of a mechanical abrasive effect to help kind of remove some of that tartar or calculus buildup on the teeth. So there is probably some benefit to chewing on harder textures, but there's kind of a fine line there because we can also see teeth that break because they're chewing on too hard of textures. So I think there's a lot of complex factors that go into an individual's propensity to develop periodontal disease or their propensity to have a broken tooth. So it's not as simple as just one food will make their teeth healthy and one food will make their teeth diseased. It's much more complicated than that. And I think kind of working with your veterinarian on a case-by-case basis to figure out what's best for your pet is really what I would recommend. Another kind of going back to chewing on hard objects too.
I wanted to come back to that.
A lot of people think, oh, I can give my dog a bone every day and they're going to chew on it and it's going to help keep their teeth clean. But that bone might be actually causing more problems by causing the tooth to break if they bite down on it just right. It could very commonly, I see this, anything from certain hard plastics that are harder than the tooth, or marrow type bones. Antlers are a big culprit, or even I think the Himalayan yak cheeses. Some of those can be really, really hard, and I've seen dogs break teeth on those as well. And kind of a common misconception I hear is that wolves in the wild chew on bones, and so that they're adapted for this. But actually, there was a recent study that looked at different. I believe they looked at the skulls of wolves that had died over a course of time, and they found that animals with broken teeth actually, were less healthy and died younger. So the wolves in the wild prefer not to have to chew on the hard things because that can actually potentially be life-threatening if they break a tooth.
Wow, that's something to think about. Another myth that still kind of persists in the world is that pets don't feel pain, or animals don't feel pain the way that humans do. And I think we know very well that this is not true, but there are still people that believe animals don't feel pain the way we do.
Yeah, and it's especially hard with dental pain because often it is chronic, low-level pain that doesn't manifest outwardly in any dramatic fashion. And so it really is just a matter of seeing kind of so many cases of this before and after when we treat dental disease. I can say with confidence that these conditions are causing a lot of pain and a lot of changes in your pet's comfort and personality and everything that can be dramatically impacted by doing a dental procedure.
And we also know biologically they have the same type of nerve fibers. They have pain receptors. They have the same areas that light up in the brain when they're experiencing a painful stimulus. So they definitely do. I think another one is that if the pet is eating fine, there's nothing wrong with their teeth. But I think we've also kind of gone over in that same that same notion that they don't tend to show us pain as readily. They kind of power through stuff, and they will tend to keep eating unless there's super, super severe pain in the mouth.
Right. I would say that actually, when an owner comes to me with the complaint that my animal hasn't been eating, I usually think it's not dental disease because most of the time they've been experiencing the dental disease for so long that they've learned to adapt, and it's actually something else going on in their internal health that's causing them to stop eating. So, animals will eat through almost anything in terms of oral pain. Stomatitis in cats is probably the one exception to that, where that can be truly painful to the point that the animal will stop eating and it can become life-threatening. But for most other dental and oral diseases, pets can power through and they don't have any changes in their food intake.
Mm-hmm. So don't avoid the dental care just because they're still eating. Unfortunately, it doesn't mean that they're not painful. So I know that you've worked a little bit with some other animals, some fun species. So give us some fun stories. What are some of the coolest species you've gotten to work with?
Sure. So when I was in my residency, I had the opportunity to go to the Belize Zoo in the country of Belize. Mm-hmm. I actually got to go 4 times to help take care of the animals' teeth there. So I was able to do root canals and extractions on jaguars and mountain lions. We did some oral exams on tapirs and coatimundis, and so just a variety of these Central and South American species. That was pretty cool. The large carnivores, the jaguars and mountain lions, are, of course, the most interesting from a dental perspective, most exciting to try to do a root canal on a tooth that large. But then I've also had the opportunity to do a few smaller pocket pet type animals. Rabbits will often get quite spectacular abscesses due to dental disease and extracting the tooth. Sometimes they will ask a veterinary dentist to get involved if there's one available. And I've done some extractions in chinchillas as well. So, kind of a variety of everything.
Yeah. No, those extractions we do a bit differently from outside of the mouth often, right?
Right. So the extractions that I've done in rabbits and chinchillas were actually an extraoral approach where, because their mouths are so small and they don't open very wide, there's no physical way for us to get in there to remove it. So we actually have to kind of approach, make a small incision in the cheek and kind of approach from the outside and pull the tooth out that way.
Yeah. So if you have bunnies or other rodents that have swelling, it's often in the lower jaw, but swelling or oozing coming out, because often it'll rupture through underneath. If you're seeing that, you definitely need to go see your vet right away. And they sometimes will stop eating sometimes when they have dental disease like that. Another one that's super important to be aware of if you have guinea pigs is their lower teeth actually can grow so long that they will entrap the tongue. So they'll grow over the tongue and they won't be able to eat normally.
Yeah, they have really interesting tooth anatomy. There are all sorts of different kinds of teeth, and a lot of our rodents and pocket pets have teeth that are continuously erupting throughout life. So they do require occlusal adjustments, or kind of going in and having their teeth filed and made sure that everything's in the right place and comfortable.
Yeah, so drooling or anything weird going on with your rabbit or rodent friends, you want to get checked out quickly. And one of the best things you can do for your oral health for those kinds of animals with those constantly growing teeth is feed them hay. A lot of people are feeding pellets as the base diet, that is really not great for their teeth. So feeding hay and making sure they have lots of chew toys, I think is really key. All right. So I would say that it's a good idea to get your animal's oral health checked out regularly with your primary care veterinarian, and be aware we have wonderful veterinary dental specialists who can do these really exciting, more advanced dental procedures as well. Or if you have a particularly delicate animal who needs specialty care, we have so many wonderful options, and it does make a huge difference in their quality of life and their overall health. So, do you have any parting comments? Anything else you would want our audience to be aware of?
I think, just it's important to advocate for your pet's health too. Make sure to ask questions when you're visiting your primary veterinarian. If they are seeing any abnormalities in the mouth, see if they can point them out to you so you can kind of see too. Be looking in your pet's mouth as often as you can. There's a lot that could be going on in terms of their overall health that you can identify just by looking in the mouth. So the mouth is a very cool place. And take good care of it, and it will make you and your pet happy.
Excellent advice. So thank you so much for sharing your time and your knowledge with us today. We learned a ton.
Thanks for having me.
An absolute pleasure. Thank you, everyone, for tuning in to this episode with Dr. Lindsey Schneider. I hope you learned as much as I did and had fun doing it. And I hope that you will like or subscribe to the podcast and come back and listen for more great information. In the meantime, go give your dogs and cats hugs and kisses for us. I hope you enjoyed this episode of Dr. A for Animals. This podcast is for educational purposes and does not substitute for specific medical advice for an individual animal or constitute the practice of veterinary medicine. No veterinary client-patient relationship is formed through listening to the podcast. If you have an animal in need of medical care, please see their veterinarian.